Welcome to the online certification of Zen RC, a new lens for the regular cornea. This course will provide information about the basic indications and fitting strategy for Zen RC. When we think of scleral lenses, we often consider scleral lenses utilized in the management of irregular corneas, like keratoconus. However, there remains a need for scleral lenses in patients with regular corneas. Many patients with high emmetropia, like high myopia, hyperopia, or astigmatism, fall outside the parameters available in soft contact lenses. Also, some patients cannot fully adapt into a corneal gas-permeable lens and drop out of gas-permeable lens wear due to discomfort and intolerance. Zen RC provides an option to visually correct this group of patients with rigid gas-permeable optics and the comfort of a scleral lens. The Zen RC Scleral Lens fitting set is comprehensive with 20 lenses designed to fit a wide range of regular corneas. Similar to Zen Lens scleral lenses, Zen RC offers two diameter choices to fit both small and large corneal diameters. The diameters of Zen RC are 14.8 and 15.4 millimeters. The Zen RC shape profile is prolate to more closely match the prolate profile of regular corneas. If there is a need to provide more mid-peripheral corneal clearance, further adjustments can be made to the base curve when troubleshooting this design. To improve oxygen delivery to the cornea, the center thickness of Zen RC is 250 microns or 0.25 millimeters thick in combination with a high decay Boston Exo material with a decay of 100 or a hyper decay material of Boston Exo 2 of 141 available upon request. The Smart Curve in Zen RC allows seamless changes to the sagittal depth and limbal clearance curve to be modified independently of one another without additional adjustments, compensation, or calculations. The fitting guide complements the 20-lens diagnostic set, allowing the practitioner to establish a starting point to begin optimizing the fit. Each diagnostic lens is laser inscribed to aid practitioners from mixing up lenses. Just like the Zen Lens Scleral Lens, Zen RC allows for independent manipulation of the sagittal height, limbal clearance curve, and advanced peripheral system in micron-based step changes. If flexure is present in the lens, the thickness can be manipulated with the assistance of the consultants to reduce the effect of lens flexure on the power of the lens. Optical cylinder can be applied to the lens using front surface optical toricity, whereby the lens is stabilized with either dual elliptical stabilization or toric peripheries. The Smart Curve allows independent changes to occur with either the sagittal height or the limbal clearance without affecting one another. The Smart Curve is positioned between the optical zone and the limbal clearance curve. It is available in both diameters. For example, if the practitioner wanted to increase the central clearance by increasing the sagittal height by 150 microns, the Smart Curve will compensate for the change that occurs centrally to allow the limbal clearance to remain unaffected. Similarly, changes to the limbal clearance curve can be isolated from the central sagittal depth or clearance in the same manner. Zen RC is a scleral option for patients who currently enjoy rigid gas permeable optics, but who have since become intolerant to the lenses. The smaller Zen RC designs have diameters similar to soft toric lenses, and handling is less of a barrier with this size scleral lens. Zen RC provides stable and centered optics that can accommodate an active lifestyle. Unlike corneal lenses, scleral lenses are difficult to dislodge and have to be physically removed. Zen RC can also be used for patients that are dissatisfied with their vision using soft contact lenses. Zen RC is an excellent option for patients who have optical requirements outside standard parameters. The fitting philosophies of Zen Lens and Zen RC are quite similar, so what are the key points that are different? First, the diameters are smaller for regular cornea patients. The diameters are 14.8 and 15.4, and yet they still accommodate a variety of corneal diameters. Since the overall diameter is smaller, the landing zone or advanced peripheral system, otherwise known as the APS, is also smaller. A deeper corneal clearance is not required with Zen RC since regular corneas that are being fit are not diseased corneas that have elevations that require deep vaulting sagittal depths. To further enhance centration, the limbal clearance is also designed lower than Zen lens design. Modifications can still be done to change the limbal clearance if necessary. Lastly, the design is thinner. Zen lens has a standard center thickness of 350 microns, but the standard center thickness of Zen RC is 250 microns that allows for increased oxygen availability to the cornea. As stated previously, the Zen lens fitting philosophy is maintained with Zen RC. The Smart Curve feature is still present in the Zen RC. This feature allows for isolated independent parameter modifications that do not affect the rest of the fit. All of the curves can be customized from base curve, sagittal depth, limbal clearance curve, and advanced peripheral system. Even though the APS in Zen RC is smaller, the multi-curve peripheral system allows for a soft, comfortable landing on the conjunctiva with a broad surface area that reduces the overall risk of compression and edge impingement. Both optical toricity on the front surface and peripheral back surface toricity for improved alignment and stability can be incorporated into the Zen RC design. If flexure is a problem, the flex control option utilizing targeted thickness changes to reduce consequences of lens flexure can be added to the design. If there is a pinguecula or a conjunctival elevation that is interfering with the fit, the Zen RC, like the Zen lens, can vault the elevation by employing a peripheral microvault to the design. The location, size, and depth of the microvault can be incorporated to this design. The consultation team can help with troubleshooting and lens design that can combine all the required features for improving and enhancing the fit and stability of the lens. We will now describe the strategy of fitting Zen RC for patients with regular corneas. The first step in fitting Zen RC is to determine the starting lens diameter. Just like Zen lens, it is important to measure the visible iris diameter. This can be done with a PD ruler, using the measurement from a topographer, or using a slit lamp reticle. If the corneal diameter is 11.7 millimeters or below, then begin with the 14.8 millimeter diameter. Any cornea larger than 11.7 should use the 15.4 diameter. Remember, each of the diagnostic lenses are not only labeled with a trial lens number, the beginning of the landing zone of the APS is demarcated with 6 dots evenly spaced around the periphery of the lens. If the dots are observed overlying the cornea, then the larger diameter should be used. Now that the diameter is selected, the next decision is the sagittal depth. The selection of the initial sagittal depth in Zen RC is determined by average K or average SIM keratometry readings and the corresponding base curve. Evaluating Zen RC can be easily broken down into 4 steps. First, the central clearance should be evaluated. In the Zen RC fitting set, the diagnostic lenses differ by 100 micron increments. Next, evaluate the mid-peripheral clearance. Ideally, an even and uniform clearance under the scleral lens is preferred. The mid-peripheral clearance can easily be modified by changing the base curve. A flatter base curve will raise the mid-peripheral clearance, while a steeper base curve reduces the mid-peripheral clearance. Keep in mind, any base curve changes require a power change too. The limbal clearance can be adjusted independently of the sagittal depth, and thanks to the Smart Curve, will not alter the sagittal depth either. In Zen RC, the goal is to clear the limbus, but have less limbal clearance than Zen lens in order to center the lens better. Lastly, the APS of the lens requires evaluation. Each step change in the APS in both Zen lens and Zen RC is 30 microns. If there is asymmetry to the appearance of the landing zone, whereby one meridian appears tighter or looser than the other, toric peripheries can be trialed or ordered. Let's start by evaluating the central clearance. Fill the lens with preservative-free saline and fluorescein. Evaluate the clearance first by using low magnification and diffuse blue illumination. Ratten filters help aid assessments. You want to have an even amount of clearance. The picture shown here is an example of an ideal fluorescein pattern using the Zen RC lens. If the lens is touching centrally, return to the diagnostic set and apply a lens with a deeper sagittal height. Next, we want to carefully evaluate the clearance in the center, mid-peripheral cornea, and limbus. The easiest way to evaluate and measure the clearance is using a very thin optic section of white light with high illumination at approximately 45 degrees. The clearance is the band of fluorescein. In order to measure the clearance using the slit lamp, compare the fluorescein band to the center thickness of the lens, which appears as a black band anterior to the fluorescein. The center thickness of the Zen RC diagnostic lens is 250 microns thick. Please note that the center thickness of the patient's final lenses may vary due to the lens power. The lens's actual center thickness will be displayed on the invoice and on the lens vials. An ideal starting point of clearance for Zen RC is between 250 to 300 microns. That means if the center thickness and the fluorescein band look like a 1-to-1 ratio, then there is approximately 250 microns of clearance. If the clearance does not appear to be 1-to-1 and the lens is not touching the cornea, you can add or subtract microns of clearance in your order in order to achieve the ideal appearance. Once you've determined your ideal central clearance or the modifications required to achieve it, then assess the mid-peripheral cornea. You can easily scan across the entire cornea using the optic section, observing the uniformity of the clearance. If the mid-peripheral clearance is too excessive or shallow, that can be modified by simply changing the base curve. When the base curve is changed, the central clearance will not be affected since the smart curve will allow the change to be isolated. Discuss with the consultants how much mid-peripheral clearance you require, and they will recommend a base curve change if necessary. Next, the limbal clearance should be assessed. You will use the same techniques that you use to assess clearance. First, begin with diffuse cobalt light and determine if fluorescein extends beyond the limbus. Switch to an optic section and high magnification to determine if it is excessive clearance or if there is contact. Remember, for Zen RC, the goal is to have narrow limbal clearance without touch. This image represents good limbal clearance with Zen RC. When evaluating the APS of Zen RC, the ideal peripheral landing should exhibit an even alignment with the conjunctival surface. There shouldn't be any excessive compression that results in blanching of the conjunctival vessels. If compression is present, loosen the fit by flattening the APS in 30 micron increment steps. If the lens edge is impinging into the conjunctiva, the APS is too steep and also needs to be loosened in 30 micron steps. Lastly, if there is edge lift or standoff evidenced by either fluorescein or shadow at the edge of the lens, then the lens is too loose and the APS can be steepened in 30 micron steps. Sometimes the lens may demonstrate compression, impingement, or edge lift along only one meridian. If this is the case, the landing zone can be designed toric. That simply means that one meridian is fit independently from the meridian perpendicular to it. In this photo, there is nasal edge lift as seen by the shadow. A toric diagnostic lens can be selected to further improve the alignment of the fit. Select the toric diagnostic lens within the same row of your diagnostic lens that you are currently evaluating. The periphery of the toric diagnostic lens is flat to steep to. This means that the flat meridian is 60 microns flatter than the standard APS, and the steep meridian is 60 microns steeper than the standard APS, for a total of 120 microns of peripheral toricity. There are toric laser engraved lines just outside the optic zone demarcating the flat meridian. Observe the rotation of the markings after the lens has settled and document that. When evaluating this lens, begin by evaluating your horizontal meridian first, because in most cases it will be the flat 2 meridian of the diagnostic lens that has the laser markings. If it is still too tight, then loosen the lens further than flat 2. Next, look at the perpendicular meridian where the dot is. This is the steep 2 meridian of the diagnostic lens. Adjust the lens steeper or flatter accordingly. All ordered toric lenses will have the laser markings on the meridian that is closest to the horizontal. Ideally, the dot that marks the vertical meridian will remain close to 6 o'clock for patient application. Ultimately, the toric APS will naturally align itself to most closely match the scleral toricity. Notation of the final lens orientation and lens markings should always be made once the lens has fully settled on the eye. Once your assessment of the lens fitting is complete, then the power should be determined. Over-refract the patient. Remember that each diagnostic lens has a -2 diopter power. As with any over-refraction, powers greater than 4 diopters require vertexing. Always state to the consultant whether you are reporting a final power or an over-refraction. Also, be sure to mention if you vertexed over your over-refraction. If there is cylinder in the over-refraction, you have to rule out lens flexure. An easy way to determine if there is lens flexure is to perform an over-topography or over-keratometry. The lens power and curvature is spherical in the diagnostic lens, so if there is cylinder present on the over topography or over K, then the lens has flexed. Flexure control factors add an increased center thickness in 100 micron steps. If the landing zone requires toric APS, this will reduce flexure significantly. If there is no flexure, then the front optical toricity can be incorporated into the lens, but it still requires stabilization. In the absence of the requirement of toric APS, then the lens is stabilized with dual elliptical stabilization. Otherwise, toric APS landing zones stabilize optical toricity. There are a variety of laser markings on the Zen RC that can assist you. First, in the diagnostic lenses, there are 6 equally spaced dots demarcating the beginning of the APS to help determine centration and the appropriateness of the lens diameter. Each diagnostic lens is labeled with the number to help prevent mix-ups after use. Toric markings are present on the toric diagnostic lens. All ordered lenses will have a laser engraved order identification on the lens. Any lens with toric APS will have labeling on the horizontal meridian. The right lens is always labeled with 1 dot at 6 o'clock. The left lens with toric APS will have 2 dots at 6 o'clock. If there is no toric APS in the left lens, then there is no dot. Zen RC can accommodate a wide variety of your patient's needs. There is an extensive range of sagittal depths, powers, and the ability to customize the APS. The default material of Zen RC is Boston XO with a DK of 100. Boston XO2 is also available with a DK of 141 upon request. It is easy to order Zen RC through consultation. You can order each parameter individually, or you can specify which diagnostic lens with which you established your assessment and inform the consultant of the modifications that you wish. Always remember to tell the consultant if you calculated the power or are providing an over-refraction. Also let them know if you vertexed because they would be happy to do it for you. At the end of the order, the consultant will repeat each ordered parameter for your records with an order number. Thank you for your time and attention to this certification presentation. There will be 6 brief questions